Hello everyone, my name is Akamo. I'm the head organizer of TEDxLagos. Some of you might have met me or seen me um, during events in the past, and for some of you, this might be the first time they actually seen me. So hi, good to see you virtually, and really, due to the unprecedented time that we currently live in, we decided to actually create this format. First of all, before I even dive straight into everything, I actually hope you're doing well. I hope you're actually doing very good and everything's actually going on well with you, and you are social distancing, you are, keeping safe, and you are happy, and because that's actually the most important thing that you can try and be at this time. So, jumping straight back to the reason for this format of conversation that we're having. Due to what's happening around the world, we thought as a team that it would be best for us to create a new format in a way that we actually communicate to you. Our event is supposed to be slated for later this year. However, we decided to create this new series called Conversations, where we bring some of our amazing old speakers to come share some ideas. Specifically, at this particular editions that we'll be having right now will be specifically for the COVID-19 situation. And today we do have a very special person who will be joining this call in a few seconds. Her name is Niniola Williams. She was one of our speakers a few years back, and she is a major director at the DRASA Foundation. And I think I'll let her just talk a bit more about what she does and some things about what she spoke about when she was a speaker a couple of years ago. So let me just add that onto this call. Just wait a few seconds. Hi, Nini. Hi, Nini.
Hi, Mercy. How are you?
I'm fine. I'm very good. Thank you so
Good.
much for joining our first series called Conversations. Thank you so much for accepting to do this at such a short notice. I know you are extremely busy at this time. Thank you. Thank you very much.
Thank you. Thank you for having me.
Thank you. So, I was just saying, just talking a bit about you, but I actually thought it would be best for you to just tell us about yourself, what you do, and I would then, go straight back to the talk you had when you were a speaker at TEDx Bagada a couple of years back, and why that talk is so relevant now, and wrapping it back to what you do as a foundation and how you're currently helping to flatten the COVID-19 curve and what we can all do. I just said a whole lot, so let's just start
Yeah, you
from.
just okay. Okay, hi
So let's just start
everyone.
from you.
So my name is Niniola. It's my full name, and I'm the managing director of DRASA Health Trust. And DRASA is a public health group organization based here in Lagos, Nigeria. And our focus is pretty much all around infection control, preventing the spread of infection. So at a time like this, I'm sure you can imagine that this is, something that we had somewhat anticipated may happen, but we were really hoping it wouldn't. So our role is to support governments, private sector as much as possible to ensure that this thing doesn't spread as far, and to save lives definitely in the process.
Thank you very much, Nini. Thank you. Thank you. And just jumping straight back to the talk you had in I think that was 2018. That was
Yeah.
yeah, 2018. Yes, yes. And the
Yeah.
topic, let me just be specific with the exact topic that we had talk on TED on YouTube when it came out. You could play a role in the next global outbreak. And then you were actually referencing the whole Ebola situation and how your aunt Dr. Stella actually, came in and literally helped. Let me use the word help flatten that curve, because she literally just stopped, tried to actually stop it from happening, and she really did with the help of her amazing team. And thanks to her and her team, Ebola was not able to actually spread and kill a lot of people in Nigeria. However, this is actually, even if it's actually not Ebola, it's a very serious infectious disease that is literally sweeping around the world. And can you just tell us a bit more of what your foundation is currently doing and how your talk you gave in 2018 is actually still relevant now?
Sure. So, again, like you said, the reason DRASA, the organization, started was because of my aunt and what she did. And our whole premise is the fact that one person can actually change the course of history, which is one of the things I said during my TEDx talk. And we don't take that lightly. We really believe that, individuals can make a huge difference. And so one of the things we do with DRASA is we invest in people who work in the health sector. And not just doctors and nurses, but ambulance drivers, paramedics, the cleaners of hospitals, everybody that has a role to play in delivering healthcare. We believe they're important. And so we've been having, over the last 5 years that DRASA has existed, a series of training programs, and we train people to be able to do sort of what she did. So how do you identify an infectious disease in a patient that may not tell you, because the patient doesn't always know what they have? How do you then contain it? What do you do in the states of emergency? So we've been trying to get Nigeria prepared for this point. And now, based on where we are, we're supporting right now the epicenter of Nigeria's outbreak, which is here in Lagos. So we're a member of the Emergency Operations Center response team in Lagos State, and we are responsible. We're part of a team that is training all the doctors that are going to work in all the treatment centers. So for those of us in Lagos, we know that there's one center in Yaba that's been used since the beginning of our own outbreak here. And then there are several others being set up around the city, around the state, some by private sector, some by government. And it's great to put up structures and say you have a treatment center, but if you don't have trained personnel to go into that treatment center and deliver the right kind of care to those patients, then it's not enough. So we're really invested in the human capacity and building the human resource that we have.
Thank you very much. Thank you very much. And I know that in Lagos being the epicenter of Nigeria, sadly so, I know that a major good news has been the fact that, we've seen quite a lot of recoveries, and which is actually really, really good. And a few deaths, however, a lot more recovery. So could you tell us, from your perspective, what you and your team are actually doing that is possibly helping to kind of ensure that more people actually don't get this disease?
Yeah, so I mean, what I've described is just one portion of the outbreak response. There's so many different things that are being done. Social mobilization is a huge part of it, because we know that if we don't go into the communities to educate people and sensitize them, then we won't be able to pick up these cases. In the beginning, definitely all the cases were imported. They were coming from outside the country. But now we're having cases inside Nigeria. People who never traveled are coming down with it. And so now it's a matter of going out and being active to look for those people. The airports are closed. Our borders are closed. So it's not enough to just say, oh, we're screening at the borders. Now we have what we call community transmission, which means that within the community, people are spreading it, around. And so we now have to identify those points that are spreading and break the chain of transmission and stop it so that it doesn't go further. And that involves literal, field workers going out into the communities. And then working with a lot of other hospitals, not just government hospitals, because some people who have ended up becoming positive, sometimes they seek care first in a private facility because they don't necessarily know that they have COVID. They may think they just have normal cough or flu or catarrh or whatever. So it's a collaborative effort with government, private sector, everyone. I keep saying that right now it's all hands on deck, because we need to remember that Nigeria is in the beginning of this thing. And if we look at all the other epicenters that we've had around the world, China was first, then it became Italy and UK, and now it's US. And some people are predicting that the African continent is going to be next, that we are just in our beginning of that, really big spike that every other country has seen. And so now is the time to be super vigilant and ensure that we catch all the cases and isolate them quickly.
Wow. So I know that in Lagos, Abuja, and also Ogun State, the government has issued a mandatory stay at home, more like a shutdown. Do you think this is actually I know a lot of us actually, should I say a lot of us actually staying at home? Almost everybody is actually at home. Only maybe extremely important, medical professionals actually at work, essential workers actually at work and all. So how do you think we, staying at home can actually help flatten the curve and ensure that Lagos does not become the epicenter of the world, or even, or even Africa become the epicenter of the world?
Yeah, I mean, it's what you've just said, staying at home, because we have to remember that this thing a lot of people don't have symptoms when they have it, right? So if you're asymptomatic, you have the virus in your body and you can spread it to other people unknowingly because you don't realize you're sick, because you don't have a fever, you don't have cough, you don't have anything. And so that is why staying at home is so important, because we need to halt the movement, stop movement, so that we can get a better picture and look and see from a high level, top down, what is really happening, identify the cases and isolate them so that they don't continue spreading. We've seen in other countries that is one of the core strategies. If business continues as usual, you cannot get in front of this virus to catch it and stop it. So staying at home, even though it sounds like a simple thing to do, some people are like, they're going crazy at home. They want to do something more active. They want to volunteer. They want to do this. You can volunteer, you can contribute, you can donate, you can do all that. But honestly, staying at home is one of the most important things anyone can do.
Okay, so I'm going to ask you two questions from the staying at home perspective and also the social distancing perspective.
Yeah.
So when, like you just said, when we all stay at home, the medical professionals are able to get in front of it and then just try and see from a clearer view. So, and I know there've been research back and front, because it's actually like a new thing around the world. Everybody is literally trying to like learn what's happening. There was a particular research one time that said that it was not airborne and that, the stuff stays on, this virus stays on surfaces for a particular period of time. So is it possible that if everybody stays at home, I'm just asking as a layman, I'm not like a medical professional, so I'm just asking you,
Sure.
if everybody stays at home, the people that have been infected and also maybe if the virus is in the air or something, is it possible that it's going to die at a particular time and then we can all go out living our normal lives, or is this going to be our new normal?
So, okay, a couple of things. The virus, like you've said, is new, right? I mean, when we entered 2020, nobody had any clue this is where we would end up in just a few months. So we are definitely learning. Scientists are doing research every day. New literature is coming out every day on giving us more information about this virus, how it spreads and what it does inside the human body when it infects someone. Now, in terms of the surfaces, when it first came out in January, we thought it could live on surfaces for up to 9 days. But new studies have shown that it lives on plastic and metal for 2 to 3 days. And that varies depending on the humidity, the temperature in the room, and all those things. So 2 to 3 days on plastic and metal, and then on paper and cardboard, it can live up to 24 hours. So those are facts that we know now are true. So that's why we say, a lot of the guidance that's out there says, don't touch too many things. Try not to touch too many things, and try to disinfect things often, including your phone and all that, because you don't really know where the virus is in the environment. And if you've picked it up on your hand or on a surface or something, it can stay there. You can actually pick it from, if an infected person, got on the bus or whatever before you, and then you get on, it's possible. It's not a high risk, but it is certainly possible. And I think at this point, it's important for me to explain how the virus actually gets into the environment so people can understand. So this virus lives in our lungs. When it infects you, it has to enter your eyes, your nose, or your mouth, because those all connect to your throat and your lungs. And so having the virus on my hand, like if I just touch a table or the table in front of me here, if I touch it and the virus is on the table, it's on my hand. But I'm not infected because this virus is on my hand. It's not in my body. It still has to enter my body. So if I take my hand that it has been contaminated by the virus and I eat without washing my hands, the virus will go in as I'm eating. Or if I put my finger in my nose, if I rub my eye, those are the entry points that the virus needs to get into to infect you. So that's why we say don't touch your face, and that's why we say wash your hands, because you may have the virus you may have picked it up from a surface around, because we know it lives in the environment, plastic, on metal, on paper, and so on. And the way it gets to those places is, remember, it comes from your lungs. So if I am sick, I'm coughing, I'm sneezing, even just talking like I am now, I'm actually generating microscopic droplets and aerosols that are coming out. And those tiny things that come out can travel up to 1 meter in front of me or in any direction that I'm facing. And so that's why they say social distancing. Don't go near somebody, because if you're too close to that person and their droplets are coming out, if you're close enough, like here, you can actually breathe those, as they're coming out, you can breathe those droplets directly into your own nose or mouth. Or if you're close, those droplets can fall onto your hand or onto a surface around. And so when those droplets come out and fall, somebody else can pick them up on their hands, and then subsequently they can enter through the mouth, the nose, and the eyes. So that is why social distancing is important. That is why staying at home is important. That is why disinfecting your surfaces is important. Washing your hands is important. Those are all the ways that we know we can stop this thing from continuing to infect people.
Wow, I just feel like I just had a crash course. Wow, that
Right.
was like a medical crash course, like in a few minutes. That was really, really important, because I mean, I've been personally, I've been reading up on it, and also just following the news, and but I think the way you explained it also kind of just simplified it in a way that it's also is like easily understandable. And I think from everything you said, a major part that I have actually picked up from it would be the power of like self-responsibility, like, because if you
Yeah,
don't go out, it's kind of like interact and then get extremely close to someone at a period of time, you will not be able to pick up any kind of virus, because
exactly.
so when you're at
Exactly.
home and you're pretty much like safe in your own space, as opposed to going out to mingle. And but I know for a lot of people I have been reading up online, as the people are complaining, oh my god, they're actually getting tired, and it's
Yeah,
really,
I
really, really
know.
boring. But I'll
I
just say
know.
that, I mean, just stay at home. You just be alive, right now. I mean, we can always have all the fun later. And the prayer and hope is that when this whole thing like dies down, we'll be able to kind of go back to our normal life. I'm hoping that this is actually
Right.
not going to be the new normal. I know
Right.
that
Right.
seeing from around the world, from US, UK, Italy, just seeing how the world is actually like aggressively fighting this virus, pumping in a
Yeah.
lot of funds, the private sector is like really helping, also like building like isolation centers and all that. Even individuals actually like taking up like responsibility. I'm just hoping that this whole phase actually dies down. And I'm coming back
Yeah.
to your point of how we can actually like help us in the club would literally be to stay at home and to kind of like practice social distancing. And yeah, and I'm hoping that everybody that actually watches this particular live today, and also the people that watch it later when we upload it on our channel, that they are able to listen and just please stay at
Yeah.
home, and please just protect themselves and their family and all that. And it's so interesting that in 2018, when the talk came out, and when your TEDx talk came out, it was literally from the perspective of talking about how we were able to beat as how we're all able to beat Ebola. And now seeing it now, and I'm like, and also even listening to like Bill Gates TED talk, it's like
Yeah.
it feels like the medical field was like anticipating that something to actually happen, and they were trying to
Yeah.
also prepare for that this is actually coming, this is
Yeah.
actually coming, and now it's here. Everybody's like, oh my god, as
Yeah.
in it's really scary, Nini.
Yeah,
It's
I
really
know. And
scary.
I think I just want to reassure people that, yeah, I mean, what you said is right. Most of us in the public health field, we knew this would happen. It was just a matter of timing. And
Yeah.
that is why we've been trying to shout about all these things, but now we are where we are. But I think and like you said, it's difficult, right? A lot of people are frustrated being at home. Our whole world is upside down. I mean, that's all I can say. The entire planet is upside down. And so we just need to take it day by day and try and manage our mental health and our own frame of mind to know that this is something beyond our control. Those of us that like to have control over things, this is a difficult time because we have no idea how long it's going to last. We don't know what to expect. We don't know what tomorrow is going to bring. But I think we need to rest assured that everybody that has the expertise that we need is working around the clock to try and contain this thing and save as many lives as possible. Again, the good news is that it's not a virus like Ebola. Ebola was much, much more deadly than this.
Yeah.
This one doesn't end up killing, as many people as Ebola and those other viruses that we've had in the past. So that's one thing, to kind of give some hope. And also, again, along the same lines, most of us who are young and healthy, we don't have a lot to worry about. That's not to say you should go and be reckless and disregard what the authorities are saying about staying at home, but it's just to let you be reassured that um,
Yeah.
it's not a death sentence. That's what I keep saying. This is not a death sentence. It's very similar to a flu. It's just that for people who already have a pre-existing condition, diabetes, cancers, HIV,
Mhm.
or any
Mhm.
respiratory illness like asthma or some
Yeah.
other chronic problem, then you have a much harder those kind of people have a harder recovery
Yeah.
process. But for the most part, people can survive this thing. And, people are freaking out that, Italy, there's so many deaths, but the Italian population is much older than the Nigerian population. Nigeria is a very youthful country. When you look at the breakdown of our age groups and all that, most of our people are in the youth category, whereas in Italy, most of their population is senior. So that contributes to some of what we're seeing. And please try not to over digest too much information from the news, because a lot of it is scandalous and, makes us panic. So I think trying to balance your intake of news also will help with this period of time when everything is so uncertain.
Thank you so much, Nini. Thank you. This has been really, really, really educational. I'm really, really grateful to the fact that your team at DRASA, you are also like helping to ensure that this actually, goes away as fast as it came. It actually came so fast. I'm hoping that it also goes away really fast.
I know. Yeah.
I'm so happy that the team, you're actually really helping to educate people, because that's like very, very important. Even like I know what you're doing for the health workers and everything, because honestly, if they're not actually prepared, and if they're not taught right how to actually handle cases like this, the escalation point, like it could actually escalate like a lot faster than what's actually happening now.
Yeah.
So overall, thank you so much. And I'm definitely going to reshare your talk after our session right now, just so people can actually connect the dots back. And overall, thank you so much, Nini, for joining, and thank you so much for also being always amazing. Thank you for coming and accepting this last minute. Thank you. Thank you. Have a fantastic evening.
Thank you. You too, and everyone, stay safe. Stay safe. Stay safe. Take care, everyone. Thanks, Mercy. You too. Bye.